Welcome to everybody. My name is Norbert Goldfield. I'm the founder and executive director of Ask Nurses and Doctors. I'm very excited to kick off this monthly webinar, and we have an amazing set of speakers. I'm going to ask out of courtesy for everybody to mute themselves. I'm certainly, to be unfortunately, not sophisticated enough to figure it all out. So I'm asking you just to mute yourselves, if you don't mind. Here's how we're going to organize this. We are so lucky to have these speakers. Dr. Amish Shah, who's a congressional candidate in Arizona, almost won the last time, and I think is a really good chance, as I highlighted in my note, is a really good chance for winning this time. He's going to be the first speaker. He'll take about 20 minutes. Then Kevin Quinn and Robert Field will be speaking. They are riffing off two amazing articles that they've written, and I'm really excited to hear them speak about it. And then lastly, Heather Booth, who I've also known for years. Amish Shah is just, I'm meeting him for the first time right now, and we're really looking forward to really helping out in whichever way we can. So, Amish, it's all yours, and yeah, just take it away, and we'll go from there.
Thank you. Thank you so much. I really appreciate the opportunity. I hope you can hear me pretty well. Okay, fantastic. It's good. I never know about the audio, so I really appreciate this. So I'll introduce myself first, and I'll tell you a little bit about my journey into politics. For those that don't know me, I'll try to keep this really short, and then I want to talk a little bit about healthcare changes over the last year. I have a feeling we're kind of all on the same page on this topic as well. And I would love to honestly take questions. I love that part of it, and if we have time for that, that's where I'd love to spend the most amount of time. So, Dr. Amish Shah, I'm an emergency physician. I've been practicing for about 20 years or so. I got out of residency in 2007, and I love my job. I get to care for people. I get to save lives, which is wonderful. And I realized at some point that no matter how many patients I see individually, I work within a system, and who controls that system? Politicians, people who make public policy control that system. And if some of us who understand it at the ground level do not get involved at the systems level, then we won't have our best voices helping make those decisions and be in the room. So I did some philanthropy kind of work. And it got me interested and involved in this idea that we can make difference at a systematic level or at a different level. And so I did kids charities and animal charities. And in 2017, I went to, on a whim, I Googled nearest meeting, and I'm a Democrat, so I went to a Democratic meeting, and I got drafted. So that's kind of the real story of what happened. So I ran for the Arizona House of Representatives. I ran 3 times. I won 3 times, and represented Central Phoenix. And during that time, I was really, really good at building relationships. I campaigned by knocking on doors individually. To this point, I have knocked over 23,000 doors personally, and that's how I've won 4 straight primaries. And that to me is the heart of representation, actually getting to know people and building relationships one by one.
It's like a lot of hot air.
I'm asking everybody to mute themselves, please.
Oops.
Sorry, Amish.
No problem. I hope he wasn't talking about me. but I was so knocking on doors was a really, really big thing, and I got myself, I won 3 times, and people started saying, look, it's time for you to run for higher office. Having had the experience. By the way, while I was in the legislature, I was able to build a lot of relationships with Republicans, and so it's during my time down there, the House, the Senate, and the governor, all Republican, and yet I passed 12 bills, got them signed into law, had the most number of bills signed into law of any Democrat in a decade. I had more bills passed out of committee, and I was really successful there at actually getting things done, but specifically in the healthcare space. So we can talk about those bills if you guys want, specifically what we did to try to make healthcare streamline it, make it better, and things that were wins for doctors, patients, everybody. And I'm proud of the work we did down there. So then I ran last year for United States Congress in Arizona CD1, and that is all of Northeast Phoenix, Scottsdale, Paradise Valley, Cave Creek, Fountain Hills, all that whole area. You guys, and again, a little short, and so I jumped in again, and I'm running one more time. This time, I feel like the winds are with us instead of against us, as for my conversations on the ground. So that's kind of where I am. What's been bothering me the most about healthcare over the last 6 months or so is, of course, the One Big Beautiful Bill Act, with which I vehemently disagree. I work in emergency medicine, and we take care of everybody, no questions asked.
Mm.
Well, unfortunately, I think we lost Amish Shah. First of all, think about some of the questions that you might, be asking. Everybody can hear me. Is that correct, Robert? Yeah. Okay. So I think he had a weak connection. But that's part of technology. Don't forget, folks, that 10, 15 years ago, we had none of this. I'll wait for 30, 45 seconds, Oleg, and if he doesn't rejoin, we'll go to the next presentation and have him come back on. Does that seem reasonable, Oleg?
Yes, he'll hop on shortly.
Yeah, okay. One of the questions I'd encourage people to write questions in the chat. One of the questions that I had myself is, as a practicing internist, and I'll see patients all day tomorrow. I mean, I have, unfortunately, not easy conversations, but largely successful conversations on vaccines, with my patients. And one of the questions that I have is for Dr. Shah is, how does he translate that trusted messenger sentiment to his more political presentations? And here he is.
I apologize for that. We're in the hotel, and there's some Wi-Fi issues, but I think we're better on cellular right now, so we should be okay and stable right now.
Yep. Okay.
Okay.
So
Sorry about
what
that.
I'm suggesting is, hopefully people will have good questions. I have one question for you. Why don't you go ahead and continue, and we'll go from there.
Certainly. So the big thing for me is that I vehemently disagreed with the One Big Beautiful Bill Act. As emergency physicians, we see everybody. We are mandated by law to see everybody by a law called EMTALA, and we like that. We like the idea that we need to take care of everybody that shows up. However, that means that we are compelled to see people who, if they're uninsured, would not be able to pay, wouldn't pay the hospital, wouldn't pay the doctor, et cetera. And so by cutting so many people off of Medicaid, which is what's going to happen, they put these work requirements in. Some people, just through not filling out paperwork, are going to get pushed off. And when that happens, they're all told, the CBO estimates that about 17 million people will not be able to, will be kicked off health insurance. If that happens, that leaves a massive burden on us, the doctors, the hospitals, and also the patients, because they will have to come to emergency departments instead of going to primary care visits because they lost the insurance. And it's a horrible loss for a lot of people. So suffice it to say that I disagree with it vehemently. And then my opponent, the person who I'm running against, has made statements saying that Medicare is next, and that they're going to try to cut it. So that's the non-starter for me. And what I'm going to tell you is that this is hurting us in a big way. Also, there have been assaults on science. the cuts to the NIH, and you have individuals in this administration that are saying things that are cuckoo, that are not science-based. I can't support things like that. So there's quite a lot that's hurting our industry, our profession, and I just would love to see that everybody in this country gets affordable, quality healthcare. I do believe in universal healthcare. There's many ways to get there, whether it's single payer, multi-payer, et cetera. But I do believe that we need to get everybody in America covered for their sake and for the sake of the system. So I'll stop there. I think that's a good stopping point. Would love to take some questions and see what people are curious about.
So I'll start it off by asking two questions just to try to encourage people to join in. My first is, clearly we're trusted messengers as health professionals, physicians, nurses, and so forth. How do you translate some of that trusted messenger, and what kind of pushback do you get when you're speaking with political audiences? So that's the first thing.
You're right. Most people will just assume that you have healthcare expertise because you're working in the space. And but there's an old adage from medical school that I remember, where my best teachers taught me that the old adage is, I care that you know only after I know that you care. And so we have to lead with our hearts. Honestly, when you walk into a patient room, you could be the best technical physician, and everybody knows somebody like that who cannot seem to convey to people that they care. And if you can let those patients, or in this case, those voters, know that you really care.
Please mute yourself, Cynthia and Margaret, if one of you are speaking. Thank you.
That you lead with that and say, I'm talking about these things because I care. It's also really good to have done your homework and know exactly what you're talking about whenever you propose something, to know what are the downsides of your own argument, and then what are the opponents going to argue against you. So those things will build credibility. Very few people have openly, some have, when I'm going to the doors, I'm talking about what I think is the right thing to do. Some people disagree, and sometimes they'll bring up some valid points, and I'll say, but on the whole, this is why I'm proposing that we do these things. And they're generally left satisfied, especially if you hear them out when they make whatever, they express whatever viewpoint. So that's the basics of campaigning. It's a crucial skill.
Thank you. One more question, and then we're going to open it up, for Dr. Shah has 7 more minutes. But before I ask the question, I want everybody to know that I'm making a personal donation to his campaign. We're going to be having a candidate to each for each month, in addition to amazing speakers. So like, for example, next month, you're going to be hearing about an amazing organization that just got started called Grandparents for Vaccines. That Amish, I'm sure you'd be amazed. They're having a really good success, and that can be helpful for you. The question that I have for you is, in terms of the possible shutdown, there's all sorts of ideas as to what should be the bottom lines for Democrats. And I'm wondering if you have any thoughts about, should one of the bottom lines be to either, for example, to extend the subsidies for the ACA? Should Democrats try to reverse some of the cuts in Medicaid? Do you have any thoughts on that? And I'm hoping that others will have some ideas, rather some questions from people.
I mean, I've openly said that one big ugly disaster needs to be repealed. I mean, I can't justify. They not only did they cut Medicaid with their work requirements, they also didn't get the subsidies in place, which we may see some action on. I have no idea, at some future point, but at this point they haven't really gotten there. And that also went to tax cuts for wealthy people, and also busted the federal budget deficit and debt. So I just can't tell you how strongly I oppose that bill. But if we can get subsidies for the Obamacare plans, I happen to be on one, just so you know. That's where I got my health insurance, off the exchange. And so you'll see prices start to rise for a lot of people without those subsidies. I don't think I get any subsidies in my line of work, but I know a lot of people do, and that's going to be a problem. And then I think there was a second part to your question. It was subsidies, it was Medicaid, and what was the third one?
So are those necessary, are those, movement on those necessary to prevent a government shutdown?
Oh, a shutdown. Right. So there's a lot. I'm in DC right now, and there's a lot of talk about that coming up. And I think that is a negotiating tactic that some of them may use to do that. I'm not in Congress, but I am surrounded by Congress people here at this hotel, and there's explicit talk about doing that as a negotiation tactic.
Question in the chat. Do you know if there are very many Republicans who are also unhappy with the BBB or big beautiful bill I call the big murderous bill?
To my knowledge, there is at least one. Josh Hawley has talked about how he wants to reverse the Medicaid part of it. How many colleagues he can get to join him, I don't know. That sounds a little far-fetched to me, that he's going to somehow run a repeal on that or somehow scale that back. He wrote a famous op-ed in the New York Times where he said that this is a disaster, and then he voted for it anyway. But there were 5 Republicans in total in all of Congress that voted against that bill. Maybe that would be a starting point.
Good question. How about if anybody else wants to put a question in the chat? I want to also highlight in the chat from Olac Fuentes is a great link as to how to support Dr. Shah's campaign. And I definitely want to highlight what Olac said, that let's not forget that Dr. Shah lost by a very small margin in the last election. And that last election went pretty heavily in favor of Trump. So he has a real opportunity. Highlighted in the note that I was sending out, that in the most recent congressional election, even though it was expected to be a Democratic win, the Democrat won by a huge margin, much higher than was expected. How about any last questions? Yep. How does the race look to you from Heather Booth?
Yeah, let me give you a little update on the state of the race. So I'm with regard. So I am in a primary.
Yeah.
What's that?
And is there a primary?
I am in a primary. However, I am the front runner by a mile. I have a poll. I'm at 43% of the vote already in the primary, in a very large primary. The chances of one of these opponents really catching up, especially because I won the last primary and $16 million were spent on taking my name ID to the stratosphere. It seems very unlikely that I'm going to lose the primary. Look, anything's possible. This is politics, but we have a very, very high probability of winning. The issue is, the general election. You've got to. I keep making the case. We've got to get behind one Democrat early, in order to make that person have a chance to really beat the Republican incumbent in this case. And that's all we can do. I'll tell you that we have a big deadline. I have to raise about $1.3 million. That's the cost. I mean, my staff is about half of that, and then the rest is paid political communication and miscellaneous. My guys are out there right now knocking doors in the 110-degree heat. That's why we raise the money, because we run this differently. We don't just blow this on. I run the most efficient campaign. I'm asking people, if you're a physician or if you can't afford it, it's a congressional campaign. About $1,000 is what I'm asking for. Please, I know it's a lot, but still, that's how much it takes to get us to $1.3 million. That's it. Please call me if there's anything you'd like to have an individual conversation. We have a deadline on September 30th as our next FEC deadline, and on September 30th.
Please mute yourself.
On September 30th.
Tired. I don't know.
Please mute yourselves, please.
I'm not.
Cynthia, please mute yourself. Okay.
You're giving us the best possible chance of flipping the U.S. House of Representatives. Again, mine is one of 8 seats in the entire country that is rated by Cook Political Report as the closest in the country. You're not wasting your dollars on this race. this is it. This is one of the closest in the entire country, and we're down to very thin margins. So your money is being the most effective to try to put a physician into office. So I'll just real quick, I'll tell you about. I'm seeing some of the other things in the chat, and I want
Right,
to.
but I'm gonna ask you to make it a very short answer because we
Yeah,
have to move on.
sure. So there are hospital associations in Arizona. That is a great question from Foster. Basically, I met with the CEO of Dignity recently, and he basically said the exact same thing. He's going back to the hospital alliances and saying, this is ridiculous. We've got to support Dr. Shah. So the hospitals are all on board because they're existentially threatened. Republican opponent is David Schweikert. He's the guy who got caught on camera saying we have to go after Medicare and we have to cut it. So to anybody who's a senior on this call, he's coming after you. I mean, this is what they're thinking. He's the only one who got caught on camera actually saying it. Foster also asked, where is ACEP? ACEP is one, I just met with them earlier today. They are 100% on board with me, as are many of the people in the House of Medicine. So the OBGYN folks, because I'm so solidly pro-choice, the family physicians, the radiologists, psychiatrists. I mean, I've got a very big coalition of physicians. In the state level, the Arizona Nurses Association is behind me as well. And then that's okay, and that's Heather. So that's it. I just want to, I hope that's a rapid fire answer for these questions.
Excellent.
I'm going to put my phone number in here. Please write it down. This is my personal cell. You want to talk to me about anything, give me a call. Or send me a text is better. And then what we'll do is we'll set up a time to chat, and we can chat about anything you want. So you know, I just really appreciate you guys, your time, your attention, to take time out to meet me and possibly support my campaign. So I thank you so much.
It's a joy to have you on, and it's really exciting. You're the first one. I love your smile. I'm sure everybody tells you that, and we'll hopefully we'll stay. I know we'll stay in touch because I'm going to be a supporter of your candidacy. Thank you again,
Thank you.
Dr. Shah.
Thank you guys so much. I really appreciate it. We'll talk to you guys soon.
We're lucky to have as our next two speakers. These are people, some of whom I've known for many years. Kevin Quinn and Robert Field. Kevin is going to go first. Robert Field will go next. They each have a brief slide presentation, hopefully accompanied by questions. I found the articles that they both wrote, which they'll talk about in just a second, to be quite amazing, and I'm sure you'll agree. So I'm going to leave it to you, Kevin, to take it away.
Good. Well, thank you, thank you, Norbert. And I'm going to see if I can share my slideshow. As Norbert said, it's very brief. So Norbert, can you hear me okay? And can you see the slides?
I can't see
Good.
the slides, but I cannot see the slides, but I can hear you perfect.
Oh, well, you should be able to see the slide. I believe I am sharing.
Yeah, no, I don't.
I won't do this too long. I'll just make sure that
I'm not a technological maven. If somebody else is on there who can do better than I am, I'm oh, here we go.
Now they're coming.
Yeah, good.
Great.
Those of you who know me
beautiful
know
scene.
it's always a challenge. There we go. How's
Excellent.
that?
Perfect. Go for
Okay.
it, Kevin.
So thank you, Norbert, and thank you everyone for joining us today. I'm just going to spend about 10 minutes to talk about an article recently published in the Journal of General Internal Medicine. It's called The Exceptional Nature of Healthcare as an Economic Good. It's freely available. You can get it by Googling it or contacting me. You'll see my contact information again at the end. I'd be happy to send it to you. So why did I do this? For 30 years, I've led something of a dual existence. Pardon me, I'm just going to. On the one hand, my full-time job has been as a health economist in health policy, especially paying providers, but I've also had a part-time gig as a paramedic. I've been a paramedic for 27 years. I had a 9-hour shift today. Like Dr. Shah, we treat everyone. We don't think about the payment. We think about what's good for the patient. And so I see this disconnect. Healthcare reform proposals often differ on the mix of the market is the answer, or the government is the answer. And a basic question is often ignored: is healthcare, which is desirable and scarce, similar to other economic goods that are bought and sold in the market? And when there are scarce goods, there has to be a way of allocating them. I mentioned a few here: market prices, administered prices set by the government, triage, waiting lists, et cetera, et cetera. The Heritage Foundation in Project 2025 said that healthcare is no exception to the general principle that a market economy tends to decrease costs, increase quality, increase innovation and options. I believe in that as an economist for the market as a whole, for the country as a whole. Healthcare is no exception. I think that's much too strong. On the other hand, Medicare for all, and here's a quote from Senator Sanders, looks like it's pretty much promising everything to everyone, which is a very hard thing to do, impossible, in fact. So the article, which is written for clinicians, it's in an internal medicine journal. It's written for clinicians and other people who are not necessarily health economics geeks. I describe 8 characteristics that make healthcare exceptional. And I have a friend who's an antitrust economist. He says, Kevin, every industry says it's an exception. Every industry says it's unique. And that's true. But he pointed out to me, and I agree, that what really makes healthcare exceptional, and here I'm talking about most hospital stays, physician visits, nursing home stays, drugs, etc., is these 8 characteristics are all combined. They all interact, not only in the US, but also in Canada, the UK, other rich countries. The first one, of course, is the disparity in knowledge between providers, physicians, and others, and patients. But people point out to me, I go to my mechanic knows a lot more about my car than I do. Yes, that's true. But as consumers, we have negotiating power when we have information and options and time to negotiate prices. Think of your last few encounters with the healthcare system. How much negotiating power did you really have? One of the reasons is, this is a little geeky, healthcare goods are poorly defined. We say we're going to the store to buy milk. That's actually not true. We're going to the store to buy a liter of 1% milk or a half gallon of 2% milk. Those are the defined goods of milk, if you will. In healthcare, physicians, hospitals, etc., they charge piecemeal for thousands of codes. I live in this world and I find it hard to follow. And then you get billed after the car has been driven off the lot, so to speak. Diagnosis-related groups, which Norbert based much of his career on, are a notable exception. I'll mention that a little bit later. Healthcare is very unlike housing, food, transportation, other things that we buy, major purchases. In healthcare, there's an intermediary. 80% of the money that goes to providers comes through insurers, either public or private. That's very unusual. It's also true in other countries. That tells us that it's really about inherent in healthcare. 5% of the population is 51% of healthcare expense. Any of us could enter that 5% tomorrow by visiting Dr. Shah in the emergency room with a new stroke or a bad accident or numerous other causes. And that 5% of the population, they are typically in no shape to negotiate prices with all the providers, all the services that they receive. In healthcare, the numbers are so big, the consequences are so big, unlike pretty much anything else. You make a mistake buying a house, that's unfortunate. If you have a heart attack and you get a bill from the hospital for $110,000, for a 2-day stay. That is the average in the United States as of several years ago. $110,000 in a hospital bill for a typical heart attack with a stent placement. That's the charge, not the hospital's cost and not the Medicare payment. There's barriers to entry to healthcare. We all know that, years of experience, certification, etc. It's important for quality, but it's not like a free market that anybody can enter and challenge existing providers. And then lastly, we really must address the moral dimension of who deserves to get healthcare. If I can't afford a Lexus, that is not a tragedy. If I die on the hospital lawn because I don't have money to pay for the treatment for a condition that's eminently treatable, that is a tragedy. Just a couple more comments. So free markets incentivize revenue and generation and cost reduction. Many good effects come out of that, serving more patients, etc. Also, many undesirable implications like avoiding the sick, poor, etc. The interaction of the 8 exceptional characteristics creates many opportunities to take advantage of patients. You can see that there's examples with citations in the article, and I think many people can come up with others. Traditionally, excesses have been constrained by professional ethics. Read the mission statements of the American Medical Association, the American Hospital Association. I don't have to tell you there's widespread concern that those professional ethics are slipping. So is government the answer? Government has its own downsides, and markets can work well if goods are reasonably well defined. People have time to make decisions, they can compare, et cetera, et cetera. So looking forward, and I'll just ask everyone to make sure that their microphones are muted. We do see over the last 20 and 30 years, both Democratic and Republican governments, Congress and administration, taking steps to make healthcare more suitable for market competition, defining goods like DRGs, price transparency, measuring quality, enforcing antitrust policy. So the challenge for the Heritage Foundation and other advocates of strengthening market forces is, how do you make patients as good at buying healthcare as at buying cars? And how do you mitigate the effects on those who can't pay? For the Medicare for All advocates and other advocates of weakening market forces, the challenge is, how do you implement alternative methods of allocating scarce resources across 340 million people in this huge dynamic healthcare sector? When I say that healthcare policy is hard, that's not a cop-out. I want people to come around and act as if they believe that there is no simple approach. The market is the answer, is too simplistic. Government is the answer, is too simplistic. The implication is the people you disagree with are worth listening to, and everyone should take into account these exceptional characteristics of healthcare as an economic good, what makes healthcare different. Thank you for your attention. For anyone interested, I'm going to do 1-hour presentations just on this article. And if you have a group that would, and a group can be very small, that would be interested in hearing the more on this topic, presentation and discussion, please contact me. I want to end by personally thanking Norbert. I would not have done this article if Norbert had not encouraged me. He encouraged me, he said it was a good idea, it was worth pursuing, and I'm glad I did. And I hope it helps the healthcare policy discussion in the US and in other countries as well. So thanks, Norbert.
Thank you, Kevin. Robert, you're up next, and let's see if we can make this as seamless as possible so you can show your slides. Thank you so much, Robert, for coming on.
Okay.
Amazing. It worked.
It worked. Go to slideshow. And is that visible?
Absolutely perfect. And I can hear you, and you're good to go.
Okay. I pride myself on my Zoom techniques. So this is an article. I will put a link in the chat when I'm done. And again, I'm applying economic, kind of wonky economic concepts to the role of Medicaid as a government program. My theme is Medicaid is not just charity for the deserving poor, putting that term in quotes. It spawns what are known as public goods, intangible, essential aspects of society that only the government can provide, and that every single one of us, from the poorest to the richest, relies on, even if we don't realize it. I will start with some features of Medicaid that are relevant to my premise. When it was passed, it was called the poor stepchild of Medicare. It was sort of dragged along as almost an afterthought. Much lower payment rates to doctors and hospitals, covering people who were poor, obviously don't have a lot of political clout. And it was, again, seen as an afterthought. It is anything but that today. Today, it is literally a foundation of the entire healthcare system. It covers 70 to 80 million people if you include the Children's Health Insurance program. It covers 40% of all births and about half of all children. And it's essential financial support for most hospitals, 19% of all national hospital spending, and of nursing homes. When I say public goods, to give you the wonky economic definition, it's something that's non-exclusive. In other words, you cannot exclude anyone from getting it, in particular, people who don't pay for it. And it's non-rival, meaning one person's use of it does not limit the supply available to other people. And I'll give some examples in a minute. If you can't exclude people who don't pay, you can't charge for the good. So a private company can't make a profit off of it. So if it's something you think you need, it's really the government that has to provide it. And we're often talking about goods that are intangible. For example, on the left here, the light from a lighthouse. If a ship is at sea, this is before radio location, you can't really shine a light and only people who pay will be able to use it for guidance. But once that light is out there, one ship's use of it does not limit the amount of light for other ships. National defense, as we sit here, our country is protected from foreign invasion, even if we don't think about it. And on the right, streetlights. It would be awfully difficult to charge for use of a street light, put a quarter in a light as you walk by. So we rely on the government, in this case, mostly the cities, to provide it. There are similar goods. I'm going to use the term public goods more broadly, but things are called like common goods, public education. You can certainly exclude children whose parents don't pay tuition, but public education makes it non-exclusive and non-rival. And national health insurance, healthcare, we certainly know you can exclude people who don't pay, but the government in those countries that have universal healthcare, certainly not including us, make it non-exclusive and non-rival. And then there are public, quasi-public goods like highways, where anyone can drive onto a highway. We can't put tolls on all our highways, but at some point it becomes rival because the roads get filled up. So that's the economic concept. How does that apply? Oh, I'm sorry, one other, externalities, an effect that's external to the transaction. A smokestack from a factory is causing pollution that affects other people who don't buy the goods that are produced. And a positive externality on the right here, a child getting a vaccine that produces herd immunity for all of us. Let's hope that remains. So here is what I see as 8 public goods provided by Medicaid. First, health security. The peace of mind as knowing there's a hospital and emergency room should we need them. If the horrible bill stays, a lot of rural communities are going to lose that peace of mind. And it's there even if we don't think about it all the time. Long-term care, most, as I showed earlier, most long-term care facilities rely on Medicaid to stay in business, and that relieves a burden on family caregivers. So if a loved one needs care, it relieves us or it helps us anyway, with the responsibility. Medicaid provides medical funding for medical residencies in 43 states. Medicare is the biggest funder, but Medicaid is also a major contributor, and it helps ensure that there's generation after generation of physicians and other professionals. Again, it's kind of intangible, but if that went away, we would find many fewer doctors. Healthier children. The EPSDT program provides preventive care, early diagnosis for children under Medicaid. The idea is that healthier children become healthier adults and relieve the burden on society of illness. Research shows with this kind of preventive care for children, there are fewer deaths in all age groups. Public health protection. I mentioned vaccination and herd immunity. It provides preventive care. It provided important response during the pandemic for immunization, for hospital care, for other pandemic responses. And I don't think it's a coincidence that with programs like Medicare and Medicaid and increasing government involvement over the course of the 20th century, American life expectancies not quite doubled, but went from 47 to 76 years. They're now about 78, 79. So it pretty much has doubled. So the effects are there. We don't think about it every day, but that's an important good that all of us benefit from. Health innovation. Medicaid allows states what are called waivers from federal requirements to experiment with new ways of providing care. Prime example that we benefit from is home and community-based care in lieu of institutional care, which helps a lot of disabled and elderly people stay at home and helps their families. And then because it's a major market for new drugs, because it reimburses for them, it makes the production of many new drugs financially possible. Mitigating health and social inequities. Obviously, when you allow everyone access to health care, it lessens the difference between those who can access with insurance and those who cannot. It's especially important in poorer communities. It ameliorates disparities, not just based on race, but urban versus rural. So it's particularly important in urban areas. And this increases social cohesion. It has been shown to reduce overall poverty, not just access to healthcare. There is less discrepancy in income in communities after Medicaid. This produces more stable Medicare neighborhoods, rather, better quality of life. It's a deterrent to crime. It's out there in our environment. We may not think about it every day, but it is a public good from which we are all benefiting. So those are my, that is my list of public goods that every one of us is benefiting from pretty much all the time, whether we realize it or not. And this is a point that unfortunately did not get a lot of prominence in the debates over the summer about the horrible bill, but I hope it is talked about more as debates about Medicaid continue. So thank you. I look forward to your questions.
There's a question. Thank you so much, Robert. Thank you so much, Kevin. In the couple minutes that we have, Foster Gueston has a question in the chat. The facts and rationale in these presentations are reliable, likely self-evident to many of us on this call. However, we live in a non-fact, non-expert political world right now. How do we best organize ourselves for more effective advocacy given this reality? Do we need more non-experts to put these arguments forward? So I'm going to ask people to make to Robert and Kevin to make very quick comment. I'll just make very quickly a statement that in the next, I totally agree with Foster Gueston. In the next monthly call, which will be, by the way, October 14th or 15th, we're getting final confirmation, we'll have an organization that started a few weeks ago that has had already national prominence called Grandparents for Vaccines. So that's an example of these non-experts. But do you, Robert or Kevin, do you want to make a brief comment?
What I talked about are fairly intangible, and the people don't realize that they're there. But I think to ask people what their lives would be like if these public goods didn't exist. And I'm not an advertising expert, but I think that there are ways to communicate this, and they should be as part of the next public information campaign. where you could, we already see a lot of discussion of what it would mean to rural hospitals and to safety net hospitals for Medicaid to be substantially cut. But I think to put that in real terms, you wake up in the middle of the night with chest pains, who do you call? The next hospital 100 miles away? I think it can be made real and immediate.
Well, we're going to move on because we are lucky enough to have our last speaker, Heather Booth. Heather, I met about 10 or 15 years ago. I'm at an age where, 10, 15, 20 years ago sort of blends together. And so I walked up to this lady who I'd never heard of before, and I just started asking questions because I was so impressed by her presentation. Needless to say, I didn't know that Heather Booth has a storied history that you should all look up. And I'm so pleased and to be continuing to work with her. Heather, you've got the last 15 minutes and to tell us about some of your amazing work that you're doing right now. And so important. If we're going to capture the House and the Senate, we need to be listening and thinking about what Heather has to say as part of our efforts to elect people like Dr. Shah. Thank you again, Heather, for being on the call.
This is a remarkable call. All of you are experts in your field, and you are experts on the area that is probably front and center of the greatest concern that we have in this country during a regime that is not only authoritarian, but taking away our health care and threatening our livelihoods and our lives. And you are people who understand the healthcare implication of it. Even today, the outrageous hearing that was held on Susan Menares, the former head of the CDC. I don't know if anyone got it. I saw just some press stories about it. Well, she's answering very responsibly about how they were politicizing the Department of Health and asking her to function with political direction as opposed to based on the scientific evidence. They started in a screaming match, back and forth, shouting match, attacking the lawyers, and then raising things that were just, one member said, we have you on tape. You better be answering honestly. We have you on tape. And then he had to withdraw it because there was no tape. Measles is returning. And there even may be a government shutdown threatened because they want to take away our health care in order to give tax breaks to the ultra wealthy. You are front line in the defense against these attacks because you are trusted messengers. And Norbert, you are a dear friend. And one of the many reasons I value our friendship is because even in the face of adversity, you keep on keeping on and have the voices of nurses and doctors and other health professionals to be validators and speak out the truth based on the science. I come today not as a health professional, so I turn to you for that, and thank you, but as an organizer. I started in the civil rights movement, women's movement, labor movement, many other things. But right now I'm working for a group called the Battleground Alliance. It's a modest website. We haven't sought to promote our name particularly right now, that we're backed by 60 or more major organizations, including the one that Norbert represents, but also from the communications service employees union, which has many healthcare workers in it, but also grassroots networks, Planned Parenthood, and many others around the country. And our focus is to take back Congress against this deceitful, even violent regime, and particularly to focus on those issues of real people's concerns where healthcare is primary. The way we are organized, and the group is called the Battleground Alliance. I'm the National Outreach Director for it. We focused on 38 marginal Republican districts in which we are trying to raise accountability on those members and will build coordinated campaigns, also elevating the voices of trusted messengers from those districts to try and expose what the current congressional members are doing in the Republican districts. And there's another 8 districts where Democrats are also running that's being organized on a nonpartisan basis for general accountability. So whether you're nonpartisan and just talking about the issues, or whether you're partisan. By the way, we are independent legally. It's called an independent expenditure. We're not tied to any candidate or political party, but we are driving forward to expose these candidates. I sent Norbert the list of the 45 congressional districts with the Republicans. And I'm sorry, the 38 with the Republicans, and the extra 8 that also include Democrats that we're trying to elevate because they've been champions. By the way, the district, Arizona 1st District, where Dr. Shah is running, is one, just as he said, it is one of the most important districts in the entire country. And I did hear someone offline say, oh, is that a bunch of hot air? It is not hot air, though we are not endorsing candidates, my organization. Our lives are at stake by who controls this Congress. And one of the ways we can take back a lever of power, and there's some ways we can't right now, but we can take back a lever of power by winning in the midterm elections. And there are reasons why we believe we can, particularly if we have the voices of nurses and doctors and other healthcare professionals driving forward this issue. We can win in part because even people who voted for this regime, they did not vote for this. They did not vote for taking away our health care. We just heard a presentation on Medicaid. They did not vote not only for not taking away Medicaid, but if Medicaid is undercut, if the Affordable Care Act is undercut, it means that the prices on everyone will go up. Rural hospitals are now closing. People's lives are at stake. Some people already died of measles. I just saw an article today that said 1 in 6 Americans are now not vaccinating their kids because they become skeptical about vaccination. But we can change this if we at least have one major lever of power. So one is, this is not what people voted for. These are reasons why I believe we will win with your help. Again, win on these issues. It's not what people voted for, especially on healthcare. Secondly, there are waves in midterm elections, and every midterm since 2006 has had a wave for the out-of-power party, partly saying this current regime is not doing what we want to do. It's one of the reasons that the Biden-Harris ticket lost, is that there was a revolt around the world against the incumbents. So we expect that there could be a wave with your efforts. The third is, we've seen that there's been a change on the special elections that have happened, not only at the federal and congressional level, but also on the levels of the Supreme Court race in Wisconsin, at state legislative races, and even where in extremely red districts, like in Florida and in Iowa, there's some places where Republicans who have deceitful policies on healthcare still may have won, but there was like a 20-point jump of how the opponents were operating. So we think the special elections are a sign. And then the fourth is, our numbers are increasing. Many of you have heard about the No King's Day. There was one in June, one in July, one in August, and now they'll one in September, and October 18th will be the next No King's Day. I understand there are over 1,000 events already planned, and it's only 9 days since it was announced. You can go online to find No King's Day, and you'll see events in your area. Our numbers are growing, but we need validators. We need trusted messengers. And if you are interested in this, you should give your name to Norbert. If you are connected to one of these marginal districts, and I know many of you are not. I live in Washington, D.C. I'm not in a marginal district. But, and I have the lists of them if people want it, but
I'll be sending it out.
I gave it to Norbert and he can share it. So there are 38 of these marginal districts. If you are in one, we particularly need your voice. There are 45 of other districts that are nonpartisan, including Democratic and Republican districts, where we need visibility. Some of those districts, especially Arizona 1, where Dr. Shah is, there's not enough going on. The reasons that the people who care about positive health outcomes did not win was because there isn't enough organization there. There may be a lot in New York and Westchester and LA and San Francisco, but in Arizona 1, there's not enough. And if you know physicians and nurses and health professionals in those areas, we need their voices. So I come on to this call to thank you for who you are. Thank you for living your values. Thank you, Norbert, always for being such a wonderful movement partner. And to ask you if you know healthcare professionals or trusted messengers on this critical issue in those areas that Norbert can share with you. We need those names. And if you give the names to Norbert, we will connect them with the people in those districts. And what the Battleground Alliance is doing is both on a partisan side and on a nonpartisan side, for those interested in that. We are building coordinated campaigns, driving forward on these issues to ensure that the people who represent us in Congress will save, protect, and expand the options for us on our health care and on our democracy. So again, thank you for what you're doing. Always glad
Heather,
to partner with you.
Heather, now you know, and everybody who's on the Zoom and all the people who listen to the recording know why I was so moved by when I met you 10 or 15 years ago. Thank you so much. Thank you so much to Kevin and Robert, and then also Dr. Shah. And so I think there is definitely, movement. Jim Nathan has a question that I'm going to see if I can. I'm interested in the panelist perspective on how fear is growing each day. I concur with Heather's passion and energy, but the challenges are massive. I know we cannot be silent and must speak up. We must make it safe, but I'm experiencing more individuals, especially after the Charlie Kirk killing, being more fearful. Heather, do you want to comment?
I can comment on that briefly. By the way, Jim Nathan, we didn't work together on Social Security issues, did we? Or is that was a different Jim Nathan?
It may have been, but you're going to get to know Jim Nathan because he's the originator of an organization called Floridians for Democracy, an amazing organization.
Excellent. And there are actually three of our districts are in Florida.
Right.
We have been in horrific periods before. I was in Mississippi summer in 1964. Many of you heard about it. It's the summer when Northern students were recruited to support courageous African Americans in the South struggling for the right to vote. And it was publicized because there were three of the young volunteers, Andrew Goodman, James Chaney, and Michael Schwerner, who were killed at the hands of the Klan. What you may not know, and I know only because I lived with the Hawkins family, 4 members of their family were killed after the summer, and people don't even know about that. There's much more to the story. But within a year, we won a Voting Rights Act because people organized, even when it seemed impossible. There is no other alternative. We need to organize. We need to come together. We need to use every lever at our disposal, the kind of PowerPoint and books that Kevin and Robert and others have shared with you, the research that you've done. We need that. We need educators. We need the law. We need demonstration. We need protest. And we need organizing. And my experience is that when we organize with love at the center, we have changed this world and we will change this world. And I actually don't see any other alternative. And it's what attracts so many of us to this call and to the work to which you've dedicated your lives. By the way, my father was a very prominent physician in physical and rehabilitation therapy, and my brother, John Tobis, is a physician who just passed away, but they named a $2 million chair in his name at UCLA in cardiology. He helped to create intravascular cardiology. So I come out of and others in my family are also physicians. I have great respect for this field and know how powerful and important your voices are.
Heather, that's a great note to end on. For those of you who know me, I like to start on time. I end on time. It's an honor to have seen all of you. Mark your calendars. You'll be getting the copy of the recording October 14th and 15th of next month. We'll hear from Grandparents for Vaccines. We'll hear from Anthony Flacovento, who's is a very wonderful organizer in rural healthcare and an organic farmer. Thank you to all of you for joining. It's really inspiring to hear each and every one of you. Have a great night, and we'll speak soon. Bye-bye.